Case number 4, so PFT ratio is 69%, FEV1 of 62%, the total lung capacity is 73%, but this was less than the lower limit of normal. We use ranges sometimes for any abnormalities with the spirometry as well as for the lung volumes. Again, based off of these off of this data, what does this patient have? Is it restriction, obstruction, both, or neither? And again, that goes along with the total lung capacity of less than the lower limit of normal. Again, this patient had some shortness of breath, and we were trying to evaluate why. So we see big thing from the get-go, that left thorax is, is loss of lung volume on the left compared to the right. She has good diaphragm exclusion during tidal breathing. If you don't mind playing it again, please. So during tidal breathing, there's good diaphragm exclusion. I'm sorry, there's a little bit of, we'll play that again, if you don't mind. So right here, if you look at this part of the left hemidiaphragm, there's early, if you want to call early eventration of that left hemidiaphragm. You see a little bit of scarring there at the left base. Again, it's very subtle changes that you would not pick up on a PFT or pick up on a static chest x-ray, just right here. You see that little bit of scarring. This patient actually had TB in the past. She also has some asthma, but we suspect that this early eventration, that tenting and that scarring of that left hemidiaphragm and the pleura as well was causing some of her symptoms of shortness of breath, in addition to the left lung volume loss. So again, it points out the dynamic X-ray, shows you that diaphragmatic paradox. This one is a little bit milder than the one that we saw in case number 2.